Good morning, everyone. I think we are live now. I was a bit confused. So welcome everyone to this European Innovation Council session. My name is Irene Castellano, and I'll moderate today in representation of the Research Funding Working Group and the Irish Chapter Working Group too. So if you are interested in innovation and in translating your research idea, this is a great session. We have outstanding speakers, so I hope you enjoy it. First, our first speaker is going to be Professor Mark Ferguson. So, Mark Ferguson is the chairman of the European Innovation Council Board, and he has an outstanding career. He was a professor in the University of Manchester, where he he studied scarring and temperature-dependent sex in alligators. He co-founded a biotech company, and more recently, he was Director General of Science Foundation Ireland, one of the main research funding agencies in Ireland, and he was also the Chief Scientific Advisor of the Government of Ireland. So without further ado, I would like to welcome Mark. Here we have a room full of people. I'm not sure you can see it, but I will be moving your slides from here. Thanks.
Thank you for the invitation to speak. I'm sorry I cannot be with you in person. So for the next 15 minutes or so, I'll give you a very brief overview of the European Innovation Council. Can I have the first slide, please? And perhaps on my screen, can I see the slides so that I know that I'm speaking to the correct one?
Can you see it now, or?
No, I can see you, not the slide.
Yeah, I don't think you will be able to see it, but
if they can move the camera so that I see the screen, it's just so that I can make sure that I'm speaking to the correct slide. That would be helpful.
Okay, I will try to do that.
Or if you want to share your slides, Mark, I don't know if it's easier for you.
No, they have them, I think. Otherwise, I'll do it, but I may be talking out of sync. Perfect. Perfect. Very good. Very good. No.
Is that okay, Mark?
That's perfect. That's excellent.
Okay,
Thank you very much indeed. That's very good indeed. So there are three main programs for the European Innovation Council: Pathfinder, Transition, and Accelerator, and I will say something about each of these. These slides will be available afterwards, so if anyone wants to look at the detail, particularly of the work program, feel free to distribute them. Next slide, please. So the European Innovation Council, its aim is really to identify and support breakthrough technologies, really to support the translation from the lab to the clinic and to allow the companies to scale. Next slide, please. So it's a 10 billion program, 10.7 billion is the budget. It's really about bridging the gap between research and breakthrough technologies. It is the largest deep tech investor in Europe, invests about 3 billion, and the aim is to crowd in other investors from the private sector, currently about 3 to 1, the aim is 5 to 1, really to try and enhance the European innovation ecosystem, part of implementation of the new innovation policy from the Commission. Next slide, please. So the three programs, Pathfinder, Transition, and Accelerator. In summary, Accelerator is a little bit, well, I'll start with Pathfinder first. Pathfinder is a little bit like a European equivalent of DARPA. It's got program managers. It takes a top-down challenge-based approach for really important topics. There's very active management of the program. The program managers have the ability to increase or decrease the budget of the portfolio of awards that they make. Transitions, what it says on the tin, it's transitioning from a research project to a commercial entity. It's really about trying to get proof of concept via the IP, recruit the team and so on, up to 2.5 million in a grant. About half of the funding in the last round went to individuals who previously held an ERC proof of concept grant. Another 20 or 30% came from some of the Pathfinder projects. So this is really about pulling through research into commercial entities. And then Accelerator, which is a single award to a small and medium enterprise so that SME can be in any country. It's up to 2.5 million in a grant and up to 15 million in equity. In certain circumstances, we can go to 30 million in equity. That's really about trying to crowd in the private sector to try and scale these companies to the correct scale to provide the appropriate level of funding. So in general, Pathfinder tends to be a consortia of university research groups, small and medium enterprises, large companies. Transition is a single project, usually spinning out of a university, and Accelerator is a single company. Next slide, please. So, well, what's the aim? The aim is to be the investor of choice. We want to be entrepreneur friendly. We really want to crowd in investment. That's really important. If you look at the difference between Europe and the United States, there's a huge difference in the amount of capital available for companies in Europe. So the idea is to de-risk this for the private sector, to take a higher risk than the private sector would take, to crowd in investment. As I said before, we crowd in about €3 of private money for every €1 of EIC money. And that's really important because at subsequent funding rounds, it's the private sector that's going to be funding the companies. We want to pull through these high-risk technologies, increase the European scale-ups, catalyze the innovation impacts, and the organization, the agency itself, really wants to have operational excellence, be operating on the same parameters as the private market. Next slide, please. So if you look at this and what has essentially been the results, you'll see some of that on this particular slide that's here. We've pulled through at least 50 billion of follow-on investment in the companies that we've invested in to date. The board's aim is 5 to 1. 3 to 1 is average, 5 to 1 would be best in the world. About 20% of the funding has gone to women-led companies. When we started, it was 8%. So there's been a special initiative to try to catalyze senior women as entrepreneurs or in the senior teams of the companies. 20% is not good enough. We need to get to 50%, but it's a lot better than it was, which was 8%. Over 7,000 publications, 100 patents, over 1,300 new inventions. Since the start, there are 12 companies that are unicorns, i.e. they're valued at more than €1 billion. 112 centers, i.e. companies that are valued at more than €100,000. So these are companies that didn't exist prior to the EIC, so they're only 3 to 5 years old, but yet they're developing very quickly. 25 ERC proof of concept funds have been funded through transition, as I said before, and basically there's been a steady improvement in the time to grant and investment. So this is now operating close to the private sector timelines. Next slide, please. This is the work program. I'm not going to go into this in detail. You can look at this slide. In fact, you can find it on the EIC work program, but there are call dates, there are deadlines for application, usual thing that you would find in any European program, and the dates and the topics are on this slide. Next slide, please. Something new for the work program for 2023 is an internship scheme, and this is going to work together with the Marie Sklodowsky-Curie Fellowship. So this is to give postdocs, Marie Curie fellows, the opportunity to see what it's like to work in an innovative, fast-growing deep tech company. So this is a new introduction this year in the work program. It's open to the Marie Curie recipients and also to co-fund programs. And this will really allow researchers to see what it's like to work in a biotech company or in a deep tech company, an IT company or what have you. You'll find more details of this. It will be a paid internship. You'll take a little time out, you'll be paid for that, and then you'll go back to your other program. So watch out for that. That's new this year in 2023. Next slide, please. So if we now look at the instruments in detail, Pathfinder is really about trying to pull through real important challenges, really important technologies that are important for solving societal challenges, whether it be climate, whether it be health related, whatever. Next slide, please. So multidisciplinary teams, the budget 179.5 million in 2023 for open and bottom-up calls, TRL levels 1 to 4. The grants are about 3 million. And as I said before, a consortia of applicants. The current deadline for the current call, 7th of March. Next slide, please. This is what happens during the application. You can see that it's processed in the usual way. You get information, there's a short listing, and so on. Next slide, please. Okay, so if we look at challenges, so the Pathfinder has a challenge program as well as an open up, a bottom-up program. So these are multidisciplinary teams, as I said before, looking at really important areas. 167 million for the challenges, like CO2 and nitrogen management and valorization, integrated energy storage, cardiogenomics, healthcare continuum, DNA-based digital data storage, alternative quantum, and so on. Grants are up to about 4 million in the challenges, and the next call is opening on the 20th of June with a deadline of the 18th of November. Next slide, please. So now a few words about transition. Transition is really about what it says on the tin, taking a project from the lab into a commercial entity. Next slide, please. So the budget for this year is 131 million, about 70 million for open bottom-up calls in any field of technology. So this is completely open. And then about 60 million earmarked for transition challenges, green digital devices, process and system integration for clean energy technologies and RNA-based therapies. Grants are up to about 2.5 million, more if justified. And it's open all year round. The next deadlines are 12th of April and 27th of September. Those are the deadlines that relate to when the applications will be assessed. Next slide, please. Now, Accelerator, as I said, accelerators for startups and SMEs to develop and scale their innovations. Next slide. So basically, it's for individual companies. So this is a single award. And SMEs, continuously open. It's mainly bottom up, so any area of deep technology, and it's usually blended finance that's grant plus equity. Next slide, please. So part of this is the EIC Fund. The EIC Fund manages the equity investments. It's a dedicated fund. It's owned by the Commission. It's managed by the European Investment Bank. And it bridges the equity funding gap and really tries to crowd in private investors. Next slide, please. So why apply? Why apply to the EIC? Next slide, please. So the EIC is a prestigious program. The EIC aims to be for innovation what the ERC is for research. So the European Research Council has been going some time. It's a very prestigious program for researchers. Well, the EIC aims to be the same thing for innovation. It provides a really important environment for researchers who want to explore a career in business. Application is straightforward. Basically, you can advance your career and you can move your project beyond the boundaries of research. Next slide, please. So success in Pathfinder often opens opportunities for further funding. Particularly, we see Pathfinder projects, for example, going through transition and then to the accelerator. For the university, it's a clear demonstration of their commitment to the third pillar of innovation. And the senior leaders in universities can use this to transform the way in which they pull through research and technologies into companies. Next slide, please. So I said that the Pathfinder has active management of the portfolio. This is a new thing for the Commission. It's an ARPA-like mechanism. It's used in DARPA and ARPA-E in the United States. And that involves EIC program managers. Next slide, please. So these are experienced people. They're experienced entrepreneurs or scientists. They develop the strategic visions. They work with the community, both academic and commercial, to craft the challenges each year. They manage the portfolio of projects. It's a very active management, building ecosystems with large companies, with small companies, really trying to get those challenges solved as opposed to being a paper exercise. Next slide, please. This is a picture of the current set of program managers within the EIC and their names. So if you're interested in any of these areas, feel free to contact them. It's a very proactive system. You can pick up these slides at the end. Next slide, please. So these are really about solving major societal challenges. I'll give one example on the next slide. This is a, can I have the next slide, please? This is a project which is called Trust Me, which is looking at the potential of satellites in space. Marie Curie fellowship taken through into EIC support, and you can see the case study on this particular slide. So that's essentially a nutshell of the EIC. I'd be very happy to answer any questions, and there's much more information on the EIC website. Thank you very much.
Thank you, Mark. That was a very clear, straightforward overview of the EIC. So next it will be Brian. Most of you may know him. He has been a previous chair of the MCAA, and he'll give his talk.
Thanks very much for the nice introduction, Irene, and for the great introduction of the EIC program. I will talk a little bit about, if I can find my presentation, that since a year I've been reviewing EIC proposals at the first stage. So I'll talk a little bit about the EIC Accelerator Program and kind of how it's set up and how you can apply for it. If I can find a way to, I will, yeah, I probably have to, no, I can't see, is there, oh yeah, no, here's, okay, then it's, then I can, no,
there.
So, okay, thanks. And I will just talk a little bit about how you can apply for the EIC Accelerator Program, which is one of the biggest. That the rationale behind the EIC has been explained before, so I'll skip through this slide very quickly. I think that the main point is that to reduce the gap between academic research and kind of small SMEs and kind of really creating companies that can be successful on the international market. That the Accelerator Program is meant for kind of deep tech disruptive innovations, and it's at least at the first stage that it's very forgiving of kind of if there's a good idea and that some of the details for the implementation aren't there yet, that it's mainly focused on the idea, and then through the process of applying that it really finds the projects that are worth and the companies that are worth supporting. So it's looking for startups and SMEs that are seeking to scale up. So that means that they should have the potential to create new markets or disrupt existing ones. And the innovations build on some scientific discovery that has huge impact, but achieving that impact will need the investment that is contained within the EIC. And so mostly these are ideas that are too risky to fund by private industry or venture capital, and particularly that the amount of venture capital available within Europe is much lower than the venture capital in the USA. Who can apply? In principle, that for companies that is an SME, so that's up to 250 employees, and then for small mid-caps, that's up to 500 employees, that they can apply for, not for grant funding, but for investment funding only. People can apply, but they have to have the intention to found an SME as part of the development of their idea. You can receive a different kind of blend of funding. You can have grant only, which is up to just to develop for product development. You can have grants and investment for deployment and scale up. You can have grant first or investment only. There's kind of a lot of flexibility in how the program is set up. The investment component can be between 0.5 million and 15 million in the form of direct equity or quasi-equity. And the grant component can be up to 2.5 million. And that is to be reimbursed up to a maximum of 70%. I will run through the evaluation just to see kind of how it is evaluated. At the first, it's not kind of a research proposal. it's kind of set up at the first step, that it's set up so that you fill in a web form, which is like a research proposal, but you also submit a 10-slide presentation slide deck, and you make a 3-minute video pitch. And in some ways, the video pitch doesn't have to have high production values, but it has to show the people who are involved. And sometimes even if they show the labs and the workshop where they're working, that can really give you an idea of how the company is set up. And kind of some of the companies do really kind of high production value videos, but it's not absolutely necessary. At step 1, this is where I review. If you want to review proposals for the commission, if you've ever applied on the funding and tenders portal, you just have to fill at the very bottom. There's an experts section, and you can fill in your CV, and that they look through they select people to do this, and it can be very interesting. But at first step 1, that you respond to questions from the web form, the slide deck and the video, and the 4 experts will review it. And if 2 of the experts review it positively, it goes through to step 2. So it's a very forgiving process, and it's mainly focused at this stage on the ideas. At the second step, it's to make your business plan, and you can receive help from an EIC business coach, and there's kind of AI-based platform to help with that. And that's at step 3, there's a full proposal, and that is reviewed by 3 experts remotely. And if it gets 3 positive evaluations, it goes to the next step. So that is kind of a much more critical step than the first step. But this is, once you get to this point, you have support to prepare your proposal. And if I ask at first step that there's some big problems, like they ask for 5 times the amount of funding that they could possibly get from the program, that the handlers from EIC are very forgiving. If the idea is good, that's not a reason to reject them. So it's somehow not the usual funding process or review process that I've seen. At the 4th step, you pitch your innovation. It's very much like the pitch in the ERC, where there's a panel of jury members, and then they review the proposals that will be selected to be offered to go forward to contract. So, and it's also very forgiving that they have 4 ranges of decisions that they can make: go, no go with second chance to present again, no go with seal of excellence. So there's a number of ways that you can make your proposal and your pitch better. So thanks very much. And now I will hand back to Irene and to the next speaker.
Thanks, Brian. So our next speaker is Professor William Gallagher. He is a professor in cancer biology in UCD. He is a researcher and an innovator as well. He has multiple patents, and he has co-funded a couple of companies. He was a Marie Curie fellow himself back in 1997, I think. So he will tell us a little bit about his experience in research and innovation. So the floor is yours, Liam.
Yeah, thanks, Irene. I was just wondering, could I share my screen? Is that okay? Do you mind if I do that, or will that cause problems?
Yeah, you can. Yeah, you can share your screen, please.
Tell me if it's okay then. Can everybody see that presentation?
Yeah, that's perfect.
Okay. First of all, thanks very much, and apologies I couldn't come in person, but it's probably lucky because I've just come down with a severe cold stroke flu. I'm not sure exactly what it is, but I'm staying in the basement at the moment of the house. So first of all, yeah, I just want to kind of give a brief introduction to myself. I suppose I was a Marie Curie fellow. I'm just trying to count back the years, but it's like nearly 25 years ago. So time has moved on very quickly for me. So I'm based primarily in University College Dublin in a biomedical research institute there called the Conway Institute, kind of multidisciplinary research institute. But I also have, I suppose, an interest in commercialization of research and have some experience in that area, but also broader aspects of industry academia partnerships. So I'll kind of touch upon that in the presentation. So really, I suppose the title was Leveraging Research Towards Innovation. That's the context here, and give you some case examples. So the topics going to cover really are just a bit more detail about like why I set up a company, a specific company called Oncomark, and how we actually brought that company to a successful acquisition a couple of years ago, and now what we're doing. But a bit more about working with industry partners. So again, not everybody needs to set up a company to commercialize their work. They can kind of partner with other individuals. But I think part of it is also trying to understand, I suppose, the industry sector, and the best way to do that is actually partner with industry and get a sense of what their needs are. Another part that I think I was asked to talk about was really about networks, and I think that's a critical aspect really, is that participation in multi-institutional programs provides networks that you can actually tap into, down the line. It could be 5, 10, 15 years down the line. You can actually tap into those networks that you've previously set up. So I'll give you an example or two of how we've done that. So just a brief thumbnail sketch of where I've come from. So I did my PhD in a cancer research institute in Glasgow, originally degree in Dublin, in UCD. And then I said, okay, look, I need to get outside the country a bit. So I didn't go too far. I went to Scotland to do a PhD in cancer research. And I suppose this is where I suppose my first exposure to kind of, I suppose, the process of commercialization. So the first thing, the person I was supposed to do my PhD with, the day I started, he left not sure if I pissed him off or whatever, but ultimately he left, he was going anyway to form a company or join a company. But during my PhD, there's a fairly good technology transfer arm driven by Cancer Research UK, was Cancer Research Campaign at the time. And so some aspects of my PhD were deemed to be commercializable. So we put a patent together. But I suppose it's important to note that while, patents are kind of measured, and I think Mark often comments on that, it's not really about the numbers of patents, it's about actual utilization of patents for a product. And so I think that's an important part, that many patents don't actually go anywhere because nobody really takes it up and brings it forward. But it is the first step in the process. So I decided to go a little bit further in Scotland. So I wasn't that brave, but I went to France. I had an option to go to the US or stay in Europe. So I had an opportunity to actually work in industry specifically. So I worked what is now Sanofi, was Rouen-Poulenc-Rohr in Paris. I was successful in getting a Marie Curie individual fellowship to actually work in industry. I think we were the first 3 Marie Curie fellows in the company. And we had an amazing experience just about like the process of working in a big company. It became the world's largest pharmaceutical company for about 4 months, and then another big fish swallowed another fish to make another big company. But ultimately, I suppose I learned what it was like to work in a big pharma. I kind of also got a sense that it probably wasn't going to suit me in the longer term to work in big pharma. I probably wanted to kind of do certain things, with a probably less hierarchical structure. So I suppose during that process, again, I was involved in coming up with some new intellectual property that was protected. And interestingly, the supervisor that was kind of looking after me there left halfway through to actually spawn a spin-off. We often talk about spin-outs from industry or from academia, but often you get like what appears to be the spin-outs from larger entities, particularly companies, which can be quite interesting. And so I came back to Ireland with actually benefiting from a Marie Curie return fellowship, which actually was great because I went for an academic post, didn't get it. So I said, look, I'll come with 1 year's funding back, hopefully from the Marie Curie return fellowship, and kind of ingratiated myself into the system and then managed to pull myself up through the academic ladder. And I suppose I spent a number of years trying to actually establish, I suppose, my own research program in a specific area in cancer research. And during that, I was always conscious to protect anything that I thought was useful to protect. And then I suppose my strategy was to wait until I had a kind of portfolio of something to bring forward to the market. And then I spun out Oncomark. So Oncomark has gone through a variety of different phases. We actually benefited in UCD, for example, where I'm based academically. They have a very nice campus company development program where normally to take 8 to 10 projects per year from the academics, and they say, okay, look, I'm thinking about setting up a company, but I want to kind of see, is it going to work or not? And then they kind of work with you for a period of 5 to 6 months, really trashing out, business plan, and is it worthwhile? And out of the 8 to 10, you might get, say, half of those which are successfully end up with a company. And I was fortunate at the time, a mature student came into my lab who was a chartered accountant who went back and studied biotechnology in university. And on rotation, he actually spent some time in my lab. And I said, oh, he was able to set up companies. I was a scientist, so it was a kind of useful partnership. So just a whistle stop. So ultimately, I suppose the early generation of Oncomark, a lot of it was focused on research and less on development, which was good because we set up networks. We kind of looked across for different cancer types. Our main interest was in cancer diagnostics. We kept it relatively small. It was never went beyond 20. And some companies in that space can stay quite small and quite valuable and produce. But we weren't going to go out and actually sell the assay, the diagnostic assay, to people. The whole idea was to bring it to a certain stage and then pass it on to a bigger party for clinical delivery. So we actually developed a test. One of our products that was furthest advanced was a technology called OncoMaster. And we were successful actually in one of the precursor programs to the EIC, which was the SME Instrument. And what we were fortunate at that time was that there was 100% funding went to that program. So obviously with new programs, it's generally 70% funding. For very early stage, high risk stuff like this, it was fantastic at 100% funding. And that was actually a trigger also for external investment because, the investors were saying, oh, look, you're getting 2.7 million. Maybe it's a bit de-risked now because, so it's a kind of similar model now to this idea of gathering kind of additional investment. So just one slide on the kind of technology that we developed. So there's a particular issue with early stage breast cancer, potential overtreatment, and there's been a tradition for a number of going back a number of decades of really potential overtreatment, just to actually make sure that we catch individuals that potentially could benefit from chemotherapy. And we didn't have very good ways of segregating risk of recurrence, distant recurrence once the primary tumor was removed. So about 70% of those patients don't need chemo, and we need better tests to segregate those prognostic tests. There are some out in the marketplace, but we kind of said, okay, we could actually do better. So we actually developed a test which actually involves just a measurement of 3 genes on tumor tissue that can predict whether following surgical resection, we can actually predict a risk of distant recurrence, whether it spreads around the body over a 10-year period with a high degree of accuracy. And the whole idea was that pretty much all of the competitor tests were done in a centralized lab. So you had to send the samples to that lab in California or somewhere outside your jurisdiction, whereas we developed a decentralized test in a kit format, CE marked it, that could be done in a local hospital in a very easy way. And we spent the whole idea behind the SME Instrument Program. It was almost like designed for us. We were just quite lucky at the time that we had come up with this concept jointly with an investigator in Trinity College Dublin, Adrian Bracken, and myself. We protected it, licensed it into Oncomark. We had some initial proof of concept data showing it worked, but not in an industrial environment. So it wasn't, we had to actually analytically validate the assay in a robust environment and then clinically validate it and then benchmark it versus the competitors. And that we asked for funding to do that under the SME Instrument Program. So the first time we went it, we got a good score, but that's not good enough. It was a very, very competitive program. And we benefited, I suppose, at the time is we needed additional commercial experience. So it's about your team. So we had someone who actually brought 4 or 5 products. It got FDA approval for 4 or 5 products in the diagnostics arena. We also utilized the national contact points in Ireland, which are very good. And also we tried to simplify it, the description from, as I think was previously mentioned, from like a more classical kind of research proposal towards a business oriented proposition. And the next time we got 97%. We got the top score out of 125 applications. Only 3 were funded, so it's a 2.5 percentile success. So we were delighted. And then I suppose it provided that key engine for us to do the development. So, transition something from research to a clinically validated assay, provided an opportunity we also published multiple works from this. and also utilize a network that we had actually previously generated. So just stand back a bit, I suppose, because I was a Marie Curie fellow, one of the first things I went for was essentially Marie Curie Industry Academia Partnership Program under the 6th framework. I was a Marie Curie fellow under the 5th framework. I applied some for funding, I led a smallish program for industry academia exchange. And then under the 7th program, we actually got funding under multiple programs across different cancer types. So what I'm showing here is really just a flavor of different programs which I've either run or been involved with. There's approximately 10 EU programs over a period of a decade. And this really allowed us to build networks across different cancer types, which we've tapped into now for commercialization across prostate cancer, melanoma, breast cancer. Give you one example of this here. So this is actually not under the Marie Curie program, it's under what was termed a collaborative program. It was funding for €6 million, which I led, involved a number of different academic parties, but also 2 companies, Oncomark and Agendia in the diagnostics arena, and allowed really development of proof of concept. So this idea was to develop novel diagnostics that could be tested and road tested in the clinic. And how did it come about? Well, ultimately, out of failure. So when I first finished my Marie Curie fellow, I was hitting a brick wall. I was putting in EU grants and not getting anywhere. ITNs, etc. It's very competitive. And then I said, look, I'll just take a small bit of it, chunk, and go for this industry academia partnership program. It's around €600,000, and it provided that kind of seed kind of concept of working with industry. And then from that interaction, I worked very closely with Renee Bernards, who was a leading cancer researcher in Europe in the Netherlands Cancer Institute, but also had spun out Agendia. And I phoned him up one day and I said, Renee, there's this call topic of predicting response and resistance to cancer therapy. Do you have any ideas to go for this? And he said, yes, I do. I said, a failed grant application that went to the Dutch Cancer Society, and I really want to show those that they were wrong, you know. So we took the same idea and actually just built it out, and we got the funding. So just as a whistle stop, so specifically what happened with Oncomark is the technology was licensed in 2016 from universities. We got the SME Instrument grant, and then we successfully CE marked it, and then actually went through periods of extensive clinical validation, and also worked very closely with a US company that had a diagnostic platform that we transitioned the assay onto a more point of care platform. And because the data was very positive, the actual US company bought Oncomark 2 years ago, and they're in the process of bringing that assay out into the clinic. At the same time, we took the same individuals. It wasn't a kind of split from the company. The company was sold, and we just actually set up a new company to look at similar technologies, but outside breast cancer, and this is called OncoAssure. So this company has done something similar in prostate cancer. We developed a prostate cancer prognostic assay that we have extensively clinically validated. And I suppose, again, just showing an example of leveraging networks. So in an early program which I coordinated called FastPath, this was a focus on digital pathology in prostate cancer, bringing people, academic institutions and some companies together. But critically, it involved an interaction with an investigator, urologist in Uppsala, Anders Bjartel. And when we were trying to develop a new prostate cancer signature in OncoAssure, we tapped into that network to actually gain access to samples. So it's that, you never know when you're going to use it in this and different orientations. So just to finish off, I was going to give us just in the last couple of minutes. Again, this is really about, I suppose, people potentially interested in applying to EIC. And again, I don't have any direct familiarity with the EIC, and I think it's probably looks like it's. If you look at the evaluators, they're certainly more commercial. If you look at the list of evaluators, most of them pretty all of them have business experience. So, some of what I'm saying here may not be appropriate specifically for the EIC scheme. But some general tips, like first of all, be very clear of what you're trying to solve. What is your problem? I gave you an example of the problem that we had in terms of current overtreatment of breast cancer. It's all about the need. What is the need? Are you addressing that need? Is your technology overcoming that? Is there a market? And is your technology, is it really novel? And I think that's what seems to be the focus of EIC, is really novel technologies. I don't know what it's like. At least when I'm writing a proposal, I try to avoid jargon, doublespeak, very plain English, very clear, and I assume it's going to be the case for the EIC. For collaborative programs, not all EICs or, I suppose, programs are collaborative. I think single institutions or single companies can apply for some of the mechanisms, but some are obviously collaborative in nature. And I've good experience in that, in the sense that you really need to kind of look at, does each party provide something complementary? If there's kind of a lot of duplication, it's not great. There's also can be competition. If you have two parties which are in similar territory, it can lead to friction. So I think have a very much a complementary team, that's critical. And for that, unfortunately, face-to-face meetings are critical. You know, we've done a lot by remote means, but there's no substitute in actually sitting down across the table and distilling ideas and looking in the white of someone's eyes and essentially kind of getting a read from them. You have to really do that. We benefit in Ireland, and I'm sure maybe in other countries, from proposal preparation support schemes. If you're leading, I don't know, if you're a company, I think you can get those, but you get 50% of the funding. But also there's national contact points that I would urge people to interact with. Critically, I think it's important that you discuss the thorny issues up front. Like the worst case scenario, you get the money and then it all breaks down in the contract negotiation. You've wasted all that effort because you haven't really solved the thorny issues of who owns the IP or how things are commercialized. Is there a JOMA? You really need to sort that out beforehand, because I've had a couple of cases where parties have left and it can cause frustration. And ultimately, the way I work it, at least, is each party needs to get something, and you need to be able to crystallize that. So, you know, I'll give you a good example. A company wants to validate a clinical diagnostic. You want to get access to samples. Well, why would someone give you samples unless they get something out of it? You know, there's maybe a co-authorship of a paper, there's a scientific interest. You have to really understand what the other party gets out of it and tailor your approach to that. And lastly, you know, great, you got the grant, right? But you have to deliver on it. So for me, that's when the work really happens. It's implementation, and you know, a good internal project manager is critical. Someone that really focused on the detail, but also keeping a pulse, supporting the people actually doing the work. I'll give you a good example here. So as part of the EU grant, we had a couple of issues because we're trying to integrate data across 4 or 5 different institutions. We couldn't do this by teleconference. We said, look, just bring them all to Dublin for a week. And I spent a week in the Conway, my institute boardroom, trashing out how this worked. And then the solution came. So sometimes you have to just bring people together to solve that. Okay, so I'm just going to stop sharing. Thanks very much for that. We can't hear anything, I think, in there, Irene, so I'm not sure if you're asking questions.
Hi, thank you. Yeah, so now it will be time for questions. Is the microphone working? No. You have to go up. Okay, so yeah, I would really like to thank the speakers. It was really interesting to listen first to the EIC program itself, a perspective from an evaluator, and finally some practical experience of how it is to be a researcher and join this innovation path. So now we have some time for questions. So is there any question in the audience for any of the speakers? Is the microphone working? And could we please have the speakers on the screen?
Ask a question here. Yeah, so I have a question for Mark Ferguson, first speaker, regarding the transition. I didn't get whether there is any requirement to access this kind of funding, or this is open to everyone.
So thank you for that question. At the moment, the transition program is only open to holders of the ERC proof of concept grant and also to previous Pathfinder holders. It will progressively open The only reason why it's restricted is simply the volume of applications. So there is a plan in place to progressively open that to the other European programs and then actually to national programs completely. But the challenge is this, and that is that the success rates are single digit, and that's because there's a huge number of applications. And so we're being quite careful to make sure that we don't get lots and lots and lots and lots of people to apply when actually there's a very small chance of success. So the opening of the program will correspond, hopefully, to an increase in the budget. But at the moment, it's ERC proof of concepts and Pathfinder, then it will open to the rest of the European programs, and then it will open to all national programs and be completely open. And as I said before, it's simply logistics, recruitment of the staff within the agency, because EIC is new, but more importantly, the board does not want thousands and thousands and thousands of applications, and the success rate only going to be like 1% because we don't have the budget. That's not a good use of anybody's time.
Thank you very much.
Hello, my question will be to Mark. Actually, I am an individual fellow currently, and it's about to finish almost in 6-7 months. So I was planning to apply to Next Generation Innovation Talents Program, which is, I think, new. But when I read the description document, it says the launch will be in the first quarter of 2023. Is it already launched, or do I need to do anything further? I don't know. Or do I need to contact with companies?
So good question. The answer is it's not yet launched. The agency is in the process of appointing a contractor who will actually manage the program, but it's on track. There are meetings with the ERC and with other programs to make sure that the information about this is appropriately disseminated through the Marie Curie, through ERC and so on. So watch this space. It will be launched. It's in the work program. It will come out in 2023. A contractor is in the process of being appointed, and then there will be a launch. I can't tell you what the date is. I don't actually know. But if you get in contact with the people within EIC, they will tell you. And it will certainly be on the website, and it will certainly go out through the Marie Curie network, and it will go out through the ERC network and the Challenges Network and any other network as appropriate. So I hope you apply, and good luck.
Do I have to do it during the fellowship, or when can I do it afterwards when it's finished?
I think so. I can't remember accurately, but as far as I remember, there is a period of time. If you've held a fellowship, for example, in a particular year, but it's come to an end, yes, I think you can apply. Please check the details. I'm only telling you off the top of my head,
okay,
but that's what I understand.
Thank you.
Hello, my question was to William. Okay. I'm very interested in how you license the patents. What it was the experience about this? Thank you.
Yeah, okay, thanks very much. So I suppose it was easy in some sense because obviously the patents that we were working with, I was a co-inventor on, and obviously the university was keen to transition that into a spin out. You know what I mean? It's also a useful metric for the university. In this particular case, for the OncoMaster technology, it was interesting because it came from the inventors were split across two academic institutions, so University College Dublin and Trinity College Dublin. So that was a slight degree of complication, but again, I think people were quite keen to kind of demonstrate that concept that you could actually have innovation occur, or new intellectual property being generated across institutions. And I suppose in our particular case, when you set up a spin out in my institution, particularly if it's based on technology that is coming from the institution, the university tends to take a piece of the pie. Do you know what I mean? So, for example, it might take 15% of your company. And I suppose my perspective is, well, you kind of need to get something in return for that. Okay, so part of returning is a favorable approach in terms of in-licensing intellectual property. Because if I was, say, for example, not connected to UCD and I was licensed that technology to another company outside UCD, they probably might, the terms might be a bit more onerous. So you have that kind of negotiation phase. In terms of, most of that, I'm being honest about it. Most of the patents I've been involved with, some of them have been licensed out, but haven't really been brought forward. You know what I mean? As I mentioned, a lot of those kind of fail in the early stages because there's no kind of developmental path. And I think that's a challenge. Is there's lots of kind of technology and lots of, like, you'll see always a lot of offerings for new IP. But you kind of need someone to really take it forward. You need a company to take it forward, and you also need to be addressing something, a key technology.
Thanks. Any other question from the audience?
Hi, I have a question to William. Just to know, what's an average time at your university to get a patent done?
It's interesting. That's a good one. Like, I suppose the starting point is like, it's not that, in my experience, it's not that hard if you work closely and interact closely with your tech transfer office. So, starting point is maybe a draft of a paper, but also kind of bullet points. We have a kind of invention disclosure form process where you get the main elements. What is the technology? What is it trying to solve? What's the unique aspects? I managed actually once. I was about to give a presentation once at a conference, and I realized, oh Jesus, I haven't protected this. And the day beforehand, I sent. We were able to actually get a patent in within the day. It was crazy because we just took the kind of presentation and the data, and they worked very hard.
That's with the University of Dublin?
No, see, again, it's key to have. It's the patent attorneys that convert that information. Now, generally, it takes a period of a couple of months to convert your, say, research paper into something that is patent, in patent format. In that particular case, we had a kind of prior structure, so we were just slotted in. So I'd say my experience has been quite positive. Again, in my institution, I don't know what it's like in others. I think the challenge is most universities face is, it's easy to submit the initial patent. The problem is the prosecution of the patent costs money, and if you want to regionalize it, if you want to, say, get coverage in different territories, you can actually get, it costs up to 50,000-60,000 euro. And I have a particular case where the university kind of were making a decision where we weren't going to pay the cost. So I said, look, with my colleague, who was a chemist, we'll take it, give it to us, assign it to us, which doesn't rarely happen. Because as individuals, and we'll take the cost. So I did spend a lot of money of my own personal money, and it didn't go anywhere. So I don't mention it to my wife very often because I'll get into trouble. But that's what happens. You know what I mean? That's the cost. We're talking about 40, 50, 60,000.
But you were working with a big team, no, in the patent office, or I mean, 3-4 months to me seems a dream.
Yeah, you could do it. Like, again, it should be shorter than that. I'm just saying sometimes a bit paperwork back and forth by email. I think you just have to line it up. Again, I'm not really familiar with other institutions in terms of duration, but generally, if your university is interested in technology spin-outs and they support it, they'll hopefully have the appropriate infrastructure for that. So I'll be honest, when prior to the economic crash in Ireland, right, technology innovation wasn't actually that popular, right? It was kind of, I actually got a bit of pushback around the time when I was setting up the company because it was perceived that I should be doing something else. And then when the economic crash happened, there was more emphasis on conversion of research to practical products. And then I became more of a flavor of the month. So it depends on your the environment that you're in, and the importance, the relative importance placed on innovating.
Okay, thank you.
Thank you.
I have another question, sorry, but for Mark this time. For the Pathfinder Open, what's the average rate of success? Because I've heard different rate per country, so I guess, but I'd like to know what's the general rate of success if it's available. I don't know.
Sure, it's definitely available. So I can tell you that the success rate for Pathfinder is of the order of 10 to 15%. The success rate for Accelerator is somewhere around about 8%. Accelerator has a huge volume of applications, but the Pathfinder is in double digits. It varies from call to call, but it's somewhere around 10, 15%. I think one of them has been as high as 18 or 20%, but it's off that. It varies by country. And the EIC have a very big focus on trying to improve applications, particularly in the Accelerator program, but also in the Pathfinder, which I'll explain in a moment, both for women-led projects and for widening countries. And specifically in Pathfinder, the current focus of the program managers is to look at challenges that are really important, facets of those challenges that are really important, which would make a big difference, but also to make sure that the challenges are constructed so that we could receive good applications from the widening countries. I'll give you an example. You get more applications from women in the healthcare area than you do in physics, simply because there are more of them. So you need to have some challenges in those areas if you want women applications. And likewise, in widening countries, there are areas of expertise. So we're mindful of that. We're very actively trying to promote it. Clearly, the assessment criteria is always excellence, but that doesn't mean that you can't pay attention and try and encourage particularly underrepresented groups.
Could you remind us what are the widening country, maybe?
Widening countries are essentially really the mostly new countries that joined the European Union. So it's typically, Latvia, Lithuania, Bulgaria, and so on. So they tend to have lower success rates in the excellence programs. They have lower success rates with the EIC. They have lower success rates with the ERC. They obviously have a higher success rate with the structural program. And that's the second thing which I didn't mention. And that is that in the European Innovation Council, if you are deemed to be fundable, but when we work down the list, we don't have enough budget to fund your particular project, you get what's called a Seal of Excellence. And with the Seal of Excellence, that allows the structural funds in those countries, if they want to invest in that program with no further due diligence. And this is actually quite important, particularly in the Accelerator program, because it also allows the country to invest in a single company, which it would not normally be allowed to do for state aid rules. So the state aid rules are disapplied if you have a Seal of Excellence. So there are seals of excellence in all of the three programs, and some countries, such as Poland, that have large structural funds have actually funded EIC projects through the Seal of Excellence. And in some cases, some countries have transferred that funding so that the program is actually managed by the EIC rather than by that country. So those are some of the activities to try and get as much of this funded as possible.
Okay, thank you very much.
Thank you. So we're almost on time. I don't know if there's any maybe one final question.
My question is to William. And I'm wondering, you spent like a decade on your company and develop a technology, and then you, at the end in 2018, you sell the company. What motivates you to sell the company and then starts the new company in the same direction of research and the same works, more or less?
I suppose the idea is, as I mentioned, we would never, at least when we set up the company, our philosophy wasn't to actually sell directly to patients. So for that to happen, you need to network. And the idea was, I suppose, bring the technology up to a certain point and then partner with another organization, either out-license the technology or acquire it. And again, because we have investors in the company, investors want something for their investment, and their model tends to be, when they're investing high-risk companies, is that there's an acquisition and there's a certain amount of fold investment that they get or profit. So that's a consideration when you're going into that. So personally, I was happy that it happened, because ultimately we're able to work with a company that has the reach. They have reach all over the world. We also worked with them for 2 years to transfer the technology onto a platform that's easily accessible. It's also kind of democratizes access to this technology, and actually will reduce costs overall for the healthcare system. So there's some other benefits. And in terms of setting up new, I suppose the idea was, I've done it before. Hopefully, we can do it again, but like learn from our experience. Doesn't always happen. You know what I mean? We'll see if we can kind of make a second kind of success.
Thank you. Yeah,
okay,
thank
thanks.
you so much. So with this, I think we've reached our time. There were plenty of questions here and very fruitful discussions. So I would like to thank the speakers. Thank you very much, Mark and Liam, for being here, even remotely. And thank you all for listening. Bye-bye.
Thank you. Take care.